Next story. There are some fun ones in sight. The patient went into her room in a very obvious stage voice, just loud enough for us to hear her in the main area, started saying random, unconnected sentences and phrases. Then she immediately came out, walked straight up to us and said, "How do I know if the voices are real?" She would act perfectly normal when she thought we weren't looking, but as soon as we walked loudly up to her door, she'd start talking to herself again. Yeah, no, that's not how psychosis works, lol. Good try, though. Also, there is the girl who strangled herself unconscious. There was no pressure whatsoever on her throat or neck. The doctor quietly snuck up to her, then smacked his hands together in a single giant clap. She jumped. And another patient who had seizures. She lay in bed, twitching. When I called her for lunch, I said, "All right, but if you lie there for too long, you're going to be stuck with the vegetarian option." The seizures magically stopped. That is an absolutely hilarious counter to anyone faking fainting. It's just give them a good jump scare and see if they react. Absolutely embarrassing, but funny. Next story. This just happened last week, strangely enough. I've been a nurse for 4 years now, and this is probably the worst I've seen it. A young adult comes in with a seizure-like activity. We're a neuroscience floor, so we get these a lot. Complains of severe abdominal pain related to her seizures, apparently. They run multiple CTs and MRIs that come back clean. We put her on a 24-hour VEEG machine, video EEG for those who don't know. She reportedly has hundreds of seizures throughout the night, with full-body convulsions, drooling, upper extremity contractions, and will not respond to verbal stimuli. She's not lethargic, just confused, doesn't know her own name, the place that she's in, or what time it is, but the rest of her neuro assessment is benign. No bladder incontinence during, had perfect control of all limbs. She screams for pain meds when she's not having seizures, but is for some reason refusing everything they offer her. Tylenol? Nope. Percocet? Makes her feel weird. Lidoderm patch for her abdomen. It gives her sores in her mouth. I guarantee if a doctor dropped the D word, she would have been all over that. After 24 hours of being her, thousands of dollars worth of tests being run and all coming up negative, the doctors had no choice but to send her home. She became agitated and seizing again. While the doctor is basically explaining that she's faking it, he says, "I'll wait." She immediately stops. Security had to escort her out, with me in tow, because I was too paranoid that she would throw herself on the floor before leaving and demand to be readmitted. They recommended an outpatient psych
For some reason I couldn't
which
sleep. I
made
woke
her
up with
even
an
angrier.
extreme
Lord
headache.
knows, maybe the seizures felt real to her, but she didn't need a special kind of help. Next story. Well, I'm not a doctor or a nurse, but I am a disability attorney. I've seen a few obvious fakes. My favorite was at this hearing office that's a single courtroom, sort of tucked onto the back of one of the satellite offices. Judges come down from the main ODAR office every so often to do hearings there. However, the entrance is around the side of the building, so people often go in the front of the building and sit there waiting. Even though
I've
I
decided
told
to
them
name
to
every
side. So I have
stream
this
from
client
here on
who
out.
does
The
exactly
Spectrum
that.
can burn in
She's
hell
claiming
stream.
disability in part because she can't walk more,
So I don't have to
steps
say
without
it
falling
anymore.
over in extreme pain. Uses a cane or walker to get around everywhere. Of course, none of this isn't correct.
Because I hate even using the word spectrum. As a matter of fact, it's going to be considered a cuss word in this apartment. And anybody who says that word in this apartment is going to get smacked in the mouth.
Already off. I figure that she went in the front entrance. Sure enough, as soon as I start heading towards the front of the building, I see her running around the side of the building, cane in one hand. She doesn't even notice me in the parking lot. I go back in to talk to her ahead of the hearing. Suddenly, she can't walk anymore. Yeah, there are a ton of cases where people can do short bursts of walking or even running, but can't do sustained standing or walking to hold down a light extortional level job. But
And maybe they'll get a clue.
This was straight up faking it for the hearing. Now, luckily she had other mental things that were going on with her, which were actually pretty well documented, but it was still pretty funny seeing the miracle cure come running around the side of the building. Next story. I'll tell you the opposite side of many of these experiences. When I was 23, my lung collapsed. Probably the most painful thing that had happened to me aside from broken bones and such. Went to the hospital in an ambulance, and by the time I got there, I wasn't in pain anymore. I was terrified they would think I was faking it, but thankfully the chest x-ray revealed that my lung had completed its collapse. And I guess it just hurts when it's coming apart from the chest wall. I didn't have surgery, but I was on suction, attached to the wall with a tube inserted in my chest for several days. Over the Thanksgiving holiday, standard hospital, you're left alone mostly unless you ring your bell and they can come visit you. The second day I rang my bell because I was in a bit of discomfort. No one came. Rang it again and again and again. Nothing. Picked up the phone, got an outside line, called the hospital, and asked for the nurses station on my floor. Got through to them and explained my plight. Apparently my buzzer was broken. They came down so apologetic and had a new bed delivered and transferred me to it. Point is, first time I was in huge pain, and then it was suddenly gone, and I was in fear that they'd think I was faking it. And second time, due to mechanical failure, I got ignored. It gets better. 6 months later, that lung collapsed again. I knew what the pain from before felt like, so I was like, hey, my lung's collapsing, I think. It was midnight. My friend took me to the hospital. They took x-rays and then told me not to worry and discharged me. I was like, I'm in a lot of pain here. And they were like, nonsense, there's nothing wrong. Next morning I wake up, short of breath, and the phones are ringing. It's the hospital. The doctor was reviewing the previous night's x-rays, so apparently the tech nurse, or whoever looked at it, missed that my lung had in fact collapsed. So he was demanding my address so they could send an ambulance to fetch me. That time I had the surgery to staple the lung in place. No more collapses ever since. Point is, sometimes the pros are wrong. Not wrong, but they overlook things. Human error and worry about lawsuits, I guess. And we patients can be just as nervous presenting pain to doctors because we're afraid the docs will think we're faking. Next story. I have so many of these. Male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out saying, breath. No joke. Male patient, 21 years old, admitted with inability to speak for the last 2 hours in respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid, and he's seriously just lying there with his tongue poking out like a child. I tell him to push it back in. A few hours later, the dad tells me that the boy is convulsing. I go to see him without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on its back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she's literally blowing spit bubbles. I check her reflexes and everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. are all normal, I start checking the pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name. But the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes. Then we prescribed her sugar pills because her parents wouldn't let us transfer her to psychiatry or discharge her. She finally left after 4 days. Next story. I'm an x-ray tech. All the time in the ED, you'll have patients that come in seeking things. These patients will have a bunch of x-rays ordered, so when you first start the exams, they'll be in all sorts of pain. They cannot position any body part, fighting and begging you not to do it. Then, after about 15 minutes, when they notice you're doing a good job, they stop the charade and get through the stack of images ordered on them. It's quite incredible, really. The other thing that blows my mind is when people want the worst possible outcome of their disease. Like, you can feel the craving for sympathy emanating from them. The phrase is, oh, that's really bad, isn't it? Or, oh man, is that the worst you've seen? Not said with dread, but barely hidden excitement. Next story. The best is when people bring their dog to the vet, claiming the dog is in excruciating pain when they're clearly drug seeking. Funny on numerous levels. First of all, animals don't fake pain. If anything, they go out of their way to mask it. Secondly, if you're not an established client, no vet is prescribing crap without doing a complete workup, which can easily cost $300 or significantly more. And finally, most canine pain drugs are fairly mild and only prescribed in small amounts, a week's worth. So even if you get what you want, you've probably enough in the bottle for 1 or 2 good highs, if that. Edit, and some obvious exceptions. Some vets RX out Trumadol 50 to 100 tabs at a time, which could certainly be problematic. Next story. I had a surreal encounter once. My mother-in-law is a family doctor. I went to her practice to drive her home and was sitting in the waiting area. The place is emptying out and I'm there alone. The receptionist goes downstairs to get a coffee because that's the last patient and she just has to do paperwork, then they come out. Then this haggard-looking guy wheels in a wheelchair. When she's gone, he wheels over beside me. He's coughing and sounds like and looks like death. Anyway, last patient walks out before the receptionist is back. A few minutes later, out comes my mother-in-law and sees this guy. She says immediately, "Mr. Blank, please leave." He starts on some crazy mumbling ramble about how he's in so much pain and he can't even walk anymore, and a bunch of other crap, but I remember explicitly that "I cannot walk anymore" statement. So of course, she says something like, "If you do not leave, I'm going to have to call the police." And the effing guy jumps out of the chair, can't walk my ass, and runs at her. Now, it wasn't super fast by my standards, at least at the time. I was like a 25-year-old in decent shape then. But he was going to effing mess her up by what I could tell. Thankfully, I was able to get up and sort of semi-tackle him against the wall before he got to her. But Effort was strong. I couldn't actually believe what I was seeing. So anyways, doctor's mother-in-law locked herself in the reception office that's glassed in. Apparently this kind of thing happens more than just once, which is scary. Anyways, she does that and I let my guy go, and he didn't seem like he was gonna mess with me, but I kind of think in retrospect, I probably should have kept him tackled or whatever in case he had a knife, but I thought I was invincible. Anyways, he swears at her for a while through the glass and started banging on it, and it was as if I wasn't there. I thought he might come at me or try to hit me, but no, he was just boxing the glass in front of him. The one funny part was the secretary opened the door to come in and saw the guy and spilled her coffee and ran like the devil away. The look on her face was priceless, but Lunatic Man was oblivious. Anyways, maybe like 15 minutes later, a couple of cops did show up, and weirdly, the guy kind of calmed down when they did. They cuffed him and took him away, and then we did reports, and like an hour later, I was able to finally drive her home. But she said the guy just wanted drugs, and she saw that a lot. I still thought it was crazy he couldn't walk. Next story. Student nurse, but this happened when I was at the gym. Guy next to me fell off the elliptical, somehow got his foot trapped between the foot pedals and went sideways. The surprisingly inept PTs, personal trainers, are usually well trained in first aid, were freaking out, and this guy is really hamming it up. Talks of calling an ambulance are thrown about, and I offer to step in. "Ah, my ankle!" He's on the floor grabbing his leg, and I kneel next to him. "Hey, bro," I greet him. He's so surprised that I'm there from behind that he forgets to groan. "How much does it hurt on a scale of 1 to 10? 8, he says. I look at his ankle. There's a scratch on it the size of a penny and superficial, hardly any blood. Little red around the scratch, ankle not swollen. I ask him if he can point and flex his foot and rotate his ankle, which he can do with zero difficulty, not even a grimace. I figure he's probably hamming it up because it's embarrassing falling off a machine in front of people, so I get him an ice pack, mostly for show to be honest. Tell him he'll be fine, and tell the PTs not to call the ambulance. His sister comes to pick him up in her car, and he limps out on her. Yeah, you know, you had the charade, you had it. Down pat didn't fool OP, of course, but man, hopping out on the wrong leg. Right? Next story. Not a doctor, but I have a story. My son's uncle was pretty much bedbound. To go to the toilet, he had to use a walker, and it would take him about 10 minutes to slowly get into the toilet at the back of the house. He had the whole family waiting on him hand and foot for years. We were visiting once, and my son, a baby at the time, fell asleep in the lounge. I didn't want to move him, so I stayed behind reading a book while the rest of the family went out. The house was really quiet. I heard Uncle get up and watched him march past me with no walker and no mobility issues. He certainly jumped a foot in the air when I said hi. His face was a picture. Next story. My wife's a district nurse. She drives to people's homes, changing dressings, giving medications, etc., etc. Her job has her dealing with many people, such as gang members and people on home detention. But the worst, in her opinion, the people you never trust even a little bit, are the methadone patients. According to her, a lot of them will try anything to get a little bit more. She had one not long ago that was being extremely talkative, almost like he didn't want her to leave the house. Then he started showing her every little lump and bump. wanting her to make sure they weren't infections or anything. Although he wasn't making her uncomfortable, she did think it was strange for him, as he was normally very quiet and wanted the nurses gone ASAP. When she got back to her car, the back window had been smashed in, but all that was missing was her sharps container and the lockbox the drugs were kept in. Didn't take a genius to figure out what was going on. So she walks back to the house, looks in the front window, and sees the methadone dude and another guy sitting on the couch trying to open the lockbox and emptying the sharps container on the floor. She called the police at that point, and despite knowing that some of the needles now on the floor were from an HIV plus patient she had earlier in the day, she sat in the car until the PD arrived, because you never, ever get between a junkie and a fix. Next story. A lot of people faking pain for medication. It was obvious they were lying, since they were clearly making up the story on the spot, and it wouldn't be consistent, then they would always sneak in the, so that can get me more.
Thank you, you too.
I had one lady tell the doctor that her ex,
I gotta get ready for work in a couple
would buy her
hours.
medication and sell it on the street. Not sure what the doctor did in that one. Had a kid lie about being sick, and his mom took him to call his bluff and asked for like 20 shots for him. He started crying and told the truth, and I'm sure he got the spanking of his life. That was fun to play along with, though. Next story.
And I woke
Lady
up
that was allergic to everything.
to such a wonderful surprise. Spectrum cut off my live stream.
Pretty much anyone else, so she would stop complaining.
That's why from now on, all my live streams are going to be called the Spectrum Can Rot and Burn in Hell live stream.
And by this point,
So I don't have to say it anymore, because I'm sick of saying it.
If you didn't know, she was literally insane.
And from here on out, if anyone comes into my apartment and uses the word Spectrum, they're going to get smacked in the mouth.
When they're asking her if she can breathe or not. O2 saturation was at like 97% or something like that. Then it goes, ma'am, there's no reason why you should be having trouble breathing right now. They hung around for another couple of minutes, then bounced. Next story. ER nurse here. Not a faking it story, but this is my all-time favorite story of patient stupidity. I had a female patient in her 20s come in.
Unless the word Spectrum is followed by the phrase that maggoty whore.
Childbearing age, as if there's any chance they could be pregnant. This girl said there's no way she could be pregnant. I asked her if she was sexually active, and she said yes. When I asked if she used birth control, she said, well, I used to, but they made me fat, so I gave them to him to take. Turns out, this girl had been giving her boyfriend her birth controls to take, and sure enough, she was pregnant. Okay, I may be aloof here, but how does that work? If a guy takes birth control, nothing happens, right? Right? Not to the guy, at least. Next story.
Last time I checked, I was the one that says when my live stream ended. Not Spectrum. That maggoty whore.
It was very strange to see one doctor turn to another and say that their diagnosis was that I was fake.
It's okay, because one of these days I'm going to wind up going to a fucking loony bin. Indefinitely. Because I'm going to have one too many buffering sessions or one too many cut-off live streams. I'm going to walk into a Spectrum store with a gun and blow everybody away. Not the customers. The customers I'll probably give flowers out to right before I go behind the counter and blow everybody's fucking brains out, assuming they have any. Flowers for their condolences, for their fucking sanity too. I hate Spectrum.
My advice, take something easier than a seizure, because you're unlikely to
give everybody flowers, chocolates, teddy bears.
Figure out that they aren't true seizures.
They're sitting there waiting for customer service. And then everybody with a name tag in that store is going to get their fucking heads blown off. Sorry you've had such bad luck with Spectrum. Here you go. Here's a teddy bear. Here's a card. Here's some chocolates. Oh, you're an employee?
Turned out she got into a fight with her husband, and as he was walking out of the house, she fell on the floor to make him stand.
The employees ought to stand in the town circle and let all the customers stone them to death.
Fake seizures, which are really hard to fake. She would hold her breath and shake and roll around on the bed. Her O2 saturation dropped to the 70s from not breathing, and maybe the sensor wasn't picking it up as well as she was shaking. And we told her we'd intubate her if she couldn't protect her airway, and she would miraculously stop seizing. Never acted possible and couldn't remember the whole seizure and everything that was said. She told me she would call my manager since I said during one of her seizures we didn't need to give her Ativan. Next story. In EMS, I see fake seizures fairly often. They're hilarious. The best bit is when they keep convulsing.
I had the doctor that tomato biscuit.
But as soon as you go to poke them,
big time because it tasted like vomit.
Usually my response is along the lines of, hey, will you quit it already? Next story. Had a mother come in and insist that her child had Silver-Russell syndrome. You can go read on it. It's not that easy to fake, as it's a bunch of metabolic conditions mixed with congenital abnormalities. The kid was small, but not that small, around 6th percentile. He didn't weigh much, 5th percentile. And all of this with a right arm length 2 centimeters more than the left side. Were borderline criteria for Silver-Russell. Did genetic testing, which came back negative, but 30% of cases are negative. So the deciding factor was the soft criteria of hypoglycemia. Once she heard about this, she printed out 30 to 40 articles on the disease.
I am not going down to the kitchen to see what time it is.
Hospital.
I think all that noise had triggered my headache because as soon as I just stopped the noise, it subsided. An hour and a half. Oh, good, another Darwin Awards. Thrones about to take fucking flying lessons out my goddamn window. I can't handle that shit now with my headaches. I will destroy that son of a bitch. Right now, anything that gives me any kind of stress right now with my fucking headache is gonna fucking fly. And I'm sore like Amelia Earhart. I'm about to get a new fucking number. This piece of shit phone falls one more time. I'm gonna fuck it up. I'll end it before it does. Beat it to it. Fuck you, Spectrum.